Hello students, today we will continue with our lesson on teeth. In my last video, we have studied about the two sets of teeth. The milk teeth or the primary teeth consisting of 20 teeth, 10 in the upper jaw and 10 in the lower jaw. And the second set is the permanent teeth. The milk teeth are replaced by permanent teeth. A set of 32 teeth. Next, we have also studied about the 4 types of teeth. Here are the 4 types of teeth marked in different colors. The ones in yellow are the incisors or incisors, that is 4 plus 4, 8. We have 4 canines marked in red, 2 in the upper jaw and 2 in the lower jaw. Next are the premolars in green, 4 in the upper jaw, 4 in the lower jaw. Next are the molars in blue, 6 in the upper jaw and 6 in the lower jaw. Now the first molar begins to appear when the child is 6 years old. The next molar appears by the time the child is 12 years old. And the last molar that you can see in purple is the molar called wisdom tooth. There are 4 wisdom teeth. Now, do you know why they are called wisdom teeth? They are called wisdom teeth because they are the last ones to emerge. That happens between the age of 17 and 25. Next, we move on to the parts of a tooth. Now, the tooth has 2 parts. The crown. The crown is the part that is visible when you smile, when you speak, and the part of the tooth which is not visible and is inside the gum is called the root of the tooth. So the crown and the root. Now, the white part of the tooth is called enamel. Below the enamel, we have the dentine. Now, the white part of the tooth, that is the enamel, is the hardest substance in our body. It is harder than bone. The dentine is as hard as bone. Below the dentine, we have the soft part of the tooth called the pulp. The pulp has the nerves and the blood vessels. In this picture, you can see the jawbone and the gums. The tooth is connected to the gums and the jawbone by a hard substance called the cementum. Now we have to learn to take care of our teeth. Now we will learn about taking care of our teeth. When we eat, the food gets stuck. Small particles of food get stuck on the surface of the teeth and between the gaps in the teeth. Now, if we do not brush our teeth, what happens is germs convert the sugar in these food particles into acid and they make holes into the teeth. Now, this layer of germs, yellow in color, it's a sticky layer. It is called plaque. It also gives bad breath. A foul smell comes from your mouth when there is a layer of germs on your teeth. Cavities. What are cavities? The holes made by the germs are called cavities. And how are these holes caused? Germs convert the sugar into acid and the acid makes holes in your teeth. Now, when these cavities grow bigger and reach the pulp where there are nerves and blood vessels, that is when you start getting pain in your tooth. Now, how How can we prevent cavities? In order to prevent cavities, we must brush our teeth at least twice a day. Once in the morning and once before going to bed. Now while brushing, we have to make sure that the bristles of the toothbrush are soft, and we should opt for a toothpaste that contains a chemical called fluoride, because fluoride removes the layer of germs called plaque. We should also rinse our mouth well after every meal. We should also use floss regularly. Now floss is a nylon string that is used to take out the particles of food stuck in between our teeth. Most important, our diet must contain food that is rich in calcium and vitamin C. Now which is the food that will give us calcium? Milk, paneer, curds, all these are calcium rich food. Food that is rich in vitamin C will be fruits that are sour. You have your oranges, lemons, even capsicum. Now, once in 6 months, you should visit your doctor. The doctor will check your teeth, and if at all there are any cavities, the doctor will clean up, take out the germs in it and fill it up. Sometimes when the infection reaches the pulp, the doctors do a treatment called the root canal treatment. So children, it is very important for us to take care of our teeth. With this I finish this lesson. I will also upload a very beautiful video with some quiz questions in it. Thank you.
Open your mouth. What's in there? Those little white things are your teeth. Some of those teeth have started growing since you were 6 months old. These are called your primary teeth. You will have 20 of those, 10 on your upper jawline and 10 on your lower jawline. Think of them as placeholders for your permanent teeth that will come in later. They will go through this cycle where new teeth will grow in, then fall out, all up to the age of 12. The first time a tooth should fall out is when you're about 6 years old. So that's when you should expect your first visit from the tooth fairy. When your first tooth falls out, a new one comes in to take its place, and those will be your permanent teeth. You will have 32 permanent teeth. So, what are the jobs of the different teeth? There are 4 different types of teeth. Incisors are sharp, and they help with cutting your food into small pieces. Canines are the sharpest teeth, so they're used for tearing your food apart. Premolars have a flat biting surface, and they're used for tearing and crushing food. Molars are the largest teeth with a large flat biting surface, so they're used to chew, crush, and grind your food. Okay, it's time for a pop quiz. How many primary teeth and permanent teeth are there? A. 15 primary and 20 permanent. B. 20 primary and 32 permanent. C. 30 primary and 10 permanent. Or D. 5 primary and 25 permanent. If you said B, then you got it right. Awesome job! Your teeth are important in many ways. If you take care of them, they'll help take care of you. Strong, healthy teeth help you chew the right foods to help you grow. They help you speak clearly, and yes, they help you look your best. Brushing your teeth helps prevent plaque, which is a clear film of germs that stick to your teeth. The germs in your mouth grow around your teeth and around their gums every day. After you eat, the germs go crazy over the sugar on your teeth, like ants at a picnic. The germs break down the sugars into acids that eat away at the tooth, causing holes called cavities. Your gums are those soft pink tissues in your mouth that hold your teeth in place. Plaque also causes gingivitis, which is a gum disease that can make your gums red, swollen, and sore. If you don't take care of your teeth, cavities and unhealthy gums will make your mouth very, very sore. Eating meals will be difficult and you won't feel like smiling so much. It's time for another quiz. What would happen if you stopped brushing your teeth? A. Cavities. B. Gingivitis. C. Plaques. D. All of the above. The correct answer is D. All of the above. Great job! Let's keep going. So, you may be wondering now, how do you take care of your teeth? Well, it's actually super easy. You just have to do two things. First, brush your teeth twice a day with a toothbrush. Your toothbrush should have soft bristles and a handle that fits easily in your hand. Make sure your toothpaste has a special chemical called fluoride. Fluoride in toothpaste helps remove plaque. Remember plaque? That's the sticky film on your teeth that causes tooth decay. Make sure you only use a pea-sized dab of toothpaste on your toothbrush and try not to swallow the toothpaste while you brush. Brush towards the center of your mouth, moving the brush up and down. Don't forget to brush your tongue because sometimes little pieces of food get stuck in there too. You can use your toothbrush or a special tongue scraper to brush your tongue. Secondly, floss your teeth daily to remove little bitty pieces of food and plaque from between your teeth and your gum line. If we don't floss regularly, the plaque can harden into tartar, and once tartar has formed, it can only be removed by your dentist. Lastly, you and your family should visit the dentist for regular checkups every 6 to 8 months. And that's it. That's how you take care of your teeth. Let's see how much you can remember. How many times a day should you brush your teeth? A. 3 times a day. B. 1 time a day. C. 2 times a day. D. Never. If you said C 2 times a day, then you got it right. Great job, superstar! If you made it here, then it means you're close to knowing all you need to do to have the healthiest teeth. Besides brushing your teeth, there is more you can do to protect and take care of your teeth. The first step towards taking care of your teeth is watching what you eat. All the food that you eat is chewed by your teeth, and many small particles get stuck around and between your teeth. So you want to make sure that all the foods you are eating do not harm your teeth. Try not to eat and drink anything with a lot of sugar. These include cookies, cakes, Rice Krispies, soda, fruit juices. You can eat them sometimes, but try not to eat them too much. I know they are delicious, but the sugar from the sweets can get stuck between and around your teeth, and that can give you a cavity. Earlier, you learned all the different types of teeth you have, and to help protect all these teeth, it's important to make sure you only use your teeth for chewing food and not anything else, like opening bottles or playing with toys. Now, let's see how much you remember. Which of these foods should you try to limit to protect your teeth? A. Vegetables. B. Bread. C. Sweets. D. Fruit. If you said C. Sweets, then you are correct. You are one step closer to having a beautiful smile. If you have any questions about how to keep your teeth healthy, make sure you ask your dentist. See you later!